Better health, better care, lower cost. Everyone's talking about healthcare, but how much do you know? Better Health is brought to you in part by Sleep Better Northwest. Explore the healthcare system and listen to experts with your host, Sue Lani Madsen, here on Better Health.
Okay, well, welcome to Better Health. My guest today is Tracy Sirrine, and she is from Patients for Patients Medical.
Yes, thank you for having me.
Okay, so the name of your organization, of your business, doesn't really tell people what it's about, but it's about medicinal uses for marijuana. And
Yes.
Tell us a little bit more about what you do.
Okay, so we help patients who qualify for medical cannabis under the Washington guidelines obtain their medical cannabis authorization and have the opportunity to speak with a doctor who's familiar with cannabis and the products.
Okay.
And
he says, scoot the mic over, so there we go.
There we go. So our doctors are familiar with cannabis and the different products, and they can create a cannabis protocol for patients, something that they can start with, because cannabis is a little different for everyone who uses it.
I think most drugs are actually like that. Mm-hmm. They need to be titrated to the person's body chemistry.
Exactly. So we started our company out of a need. We saw that patients were not being served by their primary or specialty doctors, and there are a number of reasons for that. Most doctors who work in, let's say, a hospital setting or a clinical setting, most of the time have some sort of federal funding, and because cannabis is still a Schedule I drug, they are not allowed to prescribe or recommend cannabis. So even if your doctor is okay with you using cannabis and might think it's a good idea for you, they may be hesitant to write your authorization.
Okay, so you're helping facilitate that for those
Yes, we're working in conjunction with your primary and specialty doctors to facilitate your medical cannabis authorization and the education that goes with that about the new laws and access.
Okay. Well, one of the things that I think a lot of people are getting more familiar with it is because it's becoming more mainstream. This publication, which was the Inlander's Health and Home issue for November 2018, has a long article on pain management, which is a huge issue, what with how opioids and opiates are causing some severe problems, but now we're starting to discover that they're only good for the most chronic, for the most acute part of the pain.
Right.
First couple of weeks post-surgery, that sort of thing, and looking at more long-term pain management. So what have you found to be effective for some of your patients, your clients, in pain management?
So our cannabis patients utilize cannabis in all forms, and that includes topicals, tinctures, edibles, not just ones that they can buy at the stores, but they have actually learned to cultivate their own cannabis and make their own products. And so they use tinctures, they use a full extract cannabis oil, they'll use salves, and part of what we do at Patients for Patients is not only educate you and help you get your authorization, but we teach you how to make your own extractions from home.
I think that was one of the issues with the recreational marijuana legalization, but we'll talk about that in the second half of the program. I'd like to talk a little bit more about some of the uses for which the cannabis products have been found effective, at least anecdotally at this point.
Yes. So primarily we do see chronic pain patients. We see patients with epilepsy, seizure disorders. We see cancer patients and PTSD patients. PTSD and traumatic brain injury was added to the list of qualifying conditions about 3 years ago in Washington. So it's nice to be able to help our retired veterans. And, PTSD is not just for veterans. Many people suffer from PTSD. And since we don't know exactly what pharmaceuticals are best for PTSD, some people find more comfort and help in the cannabis arena.
And we talked a little bit about how, as part of plant-based medicine, there's a lot of other things that we haven't pursued. What's the status of the research for marijuana in terms of CBD and THC? In fact, it would be useful for you to explain the difference between those two as people
Okay,
listen.
so CBD is the non-psychoactive compound in the cannabis plant, and it controls inflammation. It also helps your body generate healthy cell, bone, and tissue growth. And there have been studies where it shows that CBD is beneficial if you break your bone. It can help your bones heal faster and stronger, and it also helps your body repair damaged areas. And you can use CBD topically as well as internally, and CBD doesn't get you high. So THC is the psychoactive component in cannabis, and we've seen, I'll say anecdotally, that it does help with cancer, it helps with chronic pain, it helps with seizures. There's a wide variety of uses for it, but it's important to know how much THC you really need at a medicinal level. It's not that it can't be both recreational and medical, but as far as medical goes, it does take some research to find out exactly what strain is going to be best for you and how much of that strain and in what form you might utilize it.
Right, and that's an issue with a lot of the herbal medicines, plant-based medicines, is that the quality isn't there, or isn't the quality control is provided by the companies, and there isn't an oversight.
Right. In Washington, unfortunately, we don't regulate our pesticides. For instance, there's no mandatory pesticide testing on products. We're kind of behind other states in that area. We should be regulating for pesticides. We should be mandatorily pesticide testing our products. And because there is a lack of research on what those pesticides can do for us or do to us, whether you are lighting them on fire and inhaling them or ingesting them, can cause many actually different side effects. And that's why it's important for us to start regulating that a lot stronger than we are.
I hadn't thought about the pesticides on the crops as being an issue.
Yes, and there are a lot of different strains of cannabis, and those strains are a lot of hybrids between indica and sativa, or just primarily an indica plant or a sativa plant. So as far as plant-based medicines go, cannabis comes in many different forms, many different varieties, and each one of those varieties will affect each individual differently. So it does take some trial and error, and it does, just like you said earlier, that's with any drug, and so you do have to be patient and be willing to go through that trial and error process, and maybe it works for you, and you might find that it doesn't, but the majority of the people we see, of course, find that it is helpful.
Okay. What are some of those barriers to research?
Well, interestingly enough, the first federal study was just completed in Denver, and
cool.
They did that study on Parkinson's and spinal cord pain. So they found that it was helpful in the Parkinson's in several areas, pain, anxiety, trembling, and also that it helped with spinal cord pain. The studies are out. You can actually see that study on my website in the blog section. I gave a speech for the Hope Foundation, Parkinson's Foundation, earlier this year in the middle of that study, and it's nice that it's been concluded now. That study helped get the first pharmaceutical CBD medicine on the market.
Okay, so why don't you take this opportunity to give us your website?
PatientsForPatientsMedical.com.
And is the 4 is a numeral? Or
It's FOR.
FOR, PatientsForPatientsMedical.com.
Medical.com.
All right. Well, we're coming up to about time for a break, and we'll come back and talk a little bit about the challenges with the marijuana legalization, which one would think would make things easier, but it is apparently not.
It is not.
It is not. All right, we'll be back shortly.
See you tomorrow night, and thanks again for taking care of the painting.
I got this.
Bye.
Weekends are made for painting. Let the experts at Rada Paint take care of you.
Hi. This looks amazing.
Rada Paint, over 80 years of quality, tradition, and trust. Find it in every can.
custom lighting in the kitchen.
I'm into it.
To help you be safe, Washington state law requires you to call 811 2 full business days before you plan, for example, to dig, drill, plow, pull from, or pound anything into the ground. Be prepared to provide the operator with the correct address, cross street, and a description of your work. You must mark the dig area with white paint. The operator will inform you of the utilities notified of your impending excavation. Wait for all their marks. Be safe and dig with care.
Okay, well, welcome back to Better Health, and my guest, Tracy Sirrine from Patients for Patients Medical. And again, her website, patientsforpatientsmedical.com. We're discussing the uses of medical marijuana, some of those challenges and opportunities, but also one of the challenges has been the legalization of recreational marijuana, which one would think would make things easier, but it has caused some problems. Tell us a little bit about what some of those problems are.
Okay, so we've had medical cannabis in Washington State for a little over 20 years, and we've had our recreational legal for 3 years. As soon as recreational was passed, the patient's ability to grow their own was drastically reduced in plant numbers, meaning that people who need to have a higher number in plants, and we're thinking of this in plant matter so they can actually make their own products. So if they need to make tinctures, or let's say they're juicing their cannabis, or they're making a full extract cannabis oil, that takes a lot more plant matter than just drying, curing, and smoking cannabis as the recreational needs are met that way. A lot of the products that patients need are not found on the shelves. So you're not going to be able to find juiced cannabis on the shelves. Patients can't always eat cookies and brownies that have a little bit of the cannabinoids in them that are allowed at a recreational use. Let's say a patient needs, for their chronic pain or their seizure disorder, upwards of 500 or 600 milligrams of THC a day, and they're only allowed to buy a 10 milligram brownie at the recreational store. How many of those brownies would we expect them to have to eat, and is that really going to be good for them in the end? So that's one of the problems that we have. Reducing the number of plants in Washington came with the option to register. We are the only state that does not require patients to register through the Department of Health. And that was, that has been the rule ever since medical cannabis was legalized here. In 2008, they did a comprehensive study, the stakeholders of Washington, to evaluate other states' registry programs. And they stated in that study that it would be better off for the patient's safety as long as cannabis is a Schedule I drug that we didn't have a registry. So to not register in Washington State and remain a patient, you're only allowed to grow 4 plants.
And so if you register, you could get the ability
You can
to
get
grow
a little,
more.
so automatically if you register your authorization, it will increase to 6 plants. And your doctor does have the right to write you up to 15 plants, which has been the limit in Washington State for the entire period of time we've had medical cannabis. With so many patients not wanting to register and being unwilling to give up their civil liberties and put their name on a list, with it still being a Schedule I drug, many patients chose not to register, and that limited the amount that they could grow. So that limits the amount of products they can make for themselves and what they can do at home.
So what are their other options?
We really don't have a lot of options. I mean, the products at the store are quite expensive. It's obviously a lot more cost effective if you can grow and manufacture your own products for your own needs. If you're going to the store, we have a 37% excise tax, and the only benefit of registering for a patient, they only save the 9% sales tax, or up to 9% in different areas of the state. So a lot of people joined the registry thinking that they would benefit from that 37% tax break, and they were shocked to find out that they still do pay that 37% excise tax, even though they're using it for medicinal needs.
So we used to have dispensaries, and you'd
Yes.
see a green cross and a few discreetly in different places. Now we have huge billboards everywhere. So what happened to the dispensaries?
They were completely closed down as of July 1st of 2016 in order for the state's recreational stores to be opened up. And we were promised that time that our products would be safer and more regulated, and that they would be available. Certain products would be tested more rigorously and be available to patients. We have yet to see that come to fruition in over 95% of the market. If you walked into the stores today and asked for a medical compliant product, you're typically not going to find one.
Do they not stock it because it's a bother? Or
Producers and processors, it's a cost thing for producers and processors. Many people did get into this with the idea that they wanted to keep it medical as we knew it before recreational. But what they found was, with the cost of keeping this legal entity up and above board, that the testing that's required for a product to be labeled medical, as deemed by the Department of Health, is more expensive than testing for recreational reasons. And they have to test in smaller lot numbers, for instance. They can test up to 3-pound lots. Let's say that test fails, they don't have any choice but to destroy the entire lot. And for a new producer processor that's put all of their time and money into their business, that can be hard for them to do.
How is that different from when the dispensaries were getting? They were not as tested as much, or what was different then?
We did have testing. That's why we have laboratories in Washington State, and that's something people don't really understand, is that's why the labs are in Washington State, is because growers for medical patients wanted to test their products and wanted to make sure of the potency and the cleanliness of those products. And that was up to the person who was going to resell that product from their own garden to the public. What we expected when 502 became legal for recreational here is that we would have this mandatorily tested product, and because producers and processors have the option to choose whether they want to grow for recreational or for medical, and it being, from what I've heard from them, more cost effective to grow recreationally, there are fewer or no medical products on the shelf for patients right now.
Well,
one of the things...
That's not fair.
No, and one of the reasons is, so we test for pesticides for medical products, we test for mycotoxins, we test for heavy metals. Currently, we don't have any laboratories in Washington State that are testing for heavy metals. So we can't get a medical compliant product if we don't have that piece of the puzzle.
So that was part of 502, was that you have to test these additional factors?
For it to be...
And the labs aren't testing for heavy metals?
It's a heavy expense for them. The last lab that was testing for heavy metals just decided to let their license expire. Of all of the products that were tested, when the traceability system was up and running, and we actually had good numbers from that, BioTrack, the last testing or traceability system, it showed that 99.8% of all cannabis tested was for recreational use, so only 0.02 for medical. So that can tell you on a broad level what's really available for patients.
Well, so how has this affected patients that you're working with? What's been their challenge?
It has been a challenge for them to find a product that they trust, that they can afford. They cannot just get it from another patient anymore. That has become illegal. So patients aren't allowed to legally share their medication. If they grew more than they could use and they knew someone who lived in an apartment, they used to be able to share the medication with them. They're not allowed to do that anymore.
Well, what would you like to see change in this year's legislature?
I would like for the legislatures to look at this bill, the companion bill 5052 that they passed with recreational 502, and they said we will pass it now and fix it later. It is time to fix that bill.
Pass it now and fix it later. That's always a good way to put off actually
it
doing
was
anything.
it it was devastating to the medical community.
Is that a House bill or a Senate bill?
Senate bill.
So it's Senate Bill
5052.
5052, SB 5052.
Mm-hmm.
And that one is intended to fix some of these problems that have been created for the medical
That
patients.
is called the Patient Protection Act, and it's not protecting our patients. It's not helping our patients. It's hindering.
This is the one that passed and needs fixing.
Yes.
Okay, got it.
Yes.
SB 5052 needs fixing.
It
And
needs fixing.
Has anybody mentioned, or are you aware of anybody who's got a bill ready to go?
So in
or?
speaking with the Department of Health and the Liquor Control Board, medical cannabis is not on the agenda for this legislative session. So I hope to raise awareness with the legislatures, representatives this year, and ask for them to start the conversation, address the areas that need to be fixed, and be sure that we have it on an agenda for next session. I think that we've had enough time now since it's passed to see that it's failing, and we need to be more proactive to help the patients of Washington State.
Okay, well, it sounds like it would also be a good opportunity to find some other groups to form a coalition with. Some of those interested in chronic pain management who are looking out for patients as patient advocates.
Absolutely. And we have this opiate epidemic. And so patients who have been on long-term medication from pharmaceuticals are now being weaned off or cut off of their medications, and sometimes they want to choose cannabis. Maybe they have never tried it, but they're willing to give it a try, anything to relieve the pain.
Right.
And they run into this block. So if they try it one time, it's going to be in their system for 30 days. And in that 30 days, if they see their pain management doctors and they do a UA on them and they test positive for cannabis, oftentimes they are removed from their pain contract and the doctors won't work with them anymore. And that can be from just trying one time.
Okay, that sounds like the system needs some work.
We need people who care, and I know that I've talked to several representatives who realize this is a problem, but we need Governor Inslee's attention on this. We need everyone to look beyond the money that the taxes are bringing in for recreational and look at what's going to help our citizens.
Well, it might also be an opportunity for some research with the College of Pharmacy.
Absolutely.
Here at WSU Spokane.
I think that would be fantastic.
I think you need to contact them too.
I will, absolutely.
Okay. Well, again, Tracy Sirrine, I appreciate you being here, and your website again is patientsforpatientsmedical.com.
And we keep articles of information in the blog section. You'll find the state laws there, our company policies, and articles about our problems that we're having with the system and what needs to be fixed.
Okay, a place to look for some references on the information we've discussed today. And I thank you very much for being here.
Thank you so much.
Better Health with Sue Lani Madsen is produced in Spokane, Washington by SpokaneTalksOnline.com, which is solely responsible for its content. Better Health is brought to you in part by Sleep Better Northwest. Ask Sue Lani a question, recommend a guest or topic, and hear this program again online anytime at SpokaneTalksOnline.com. Cheers to better health, and thanks for listening.